Welcome back to Ask Endocrinology channel. Happy New Year to all our friends out there and our followers.
Happy New Year.
Happy New Year. We're back again to the year 2024. And like we said last time, that this year we have many interesting topics to talk about. We are going to be dealing with many things to help our health and how we can stay healthy. Remember, the more you know, the better you are. So, today we want to start with, the most concerning or what people have been talking mostly about on which is how to lose the weight. And if you remember, in our previous video, if you're new to this channel, please kindly subscribe, look into our videos. This is a place where we talk more about how to stay healthy. We basically give just educate and guides on how you can stay healthy. And if you are not new to this channel, we welcome you back again. We hope you've been enjoying this platform. So, as we have discussed in the previous videos, ways to lose weight. And one of the things we had mentioned was your diet, doing exercise. And Dr. Hope had mentioned in the last video how she's going to be going for some marathon and going for the exercise. So, we want to talk about medications as well, because after you have done exercise, you have eaten well, sometimes you need medications to help you lose the weight. So, what are these medications that can help us lose weight? And that's what we want to talk about today.
I just wanted to add to Grace that at the beginning of the year, one of the most common New Year's resolutions is weight loss, right? People say, "Oh, I'm
Yes,
going to eat healthy. I'm
that's
going to
true.
exercise more this year." So, gym memberships increase and people start on good diets. So, we want to make sure that you can maintain that throughout the year. So, that's one thing that we've encouraged. And just so that you know, I did start on uh, my plan for the marathon. I've done
Great.
finished one Peloton program, a 6 week,
Wow.
8 week program, and I'm on the second program. So which is preparing for a 5K. So I'm doing that, and then I'm going to expand it to the preparing for the 26K. So I am trying to keep up with my exercise. I'm doing now 4 days a week
Wow.
of the running cardiovascular exercise.
Wow.
So that I'm just trying to maintain that and working on the diet, decreasing the amount of carbs in my diet and sugar and eating more fruit and vegetables. So I hope you can join me in doing that. And maybe we can add weight loss medications, right, to our regimen as well as we work on maintaining a good health. So thank
Wow.
you. Thank you, Grace.
That's very interesting, and I'm glad that you are doing it, because it's beyond just saying, you have to do it, and that's what we encourage people to do. Like, don't just say, this is what I want to do in your mind. Go out, go for it, and do it. And the staying power is also important, not just do it once, continue to do it. So, for today, let's talk about weight loss medications. I know in general we have many medications that you can use to lose weight. Maybe you have heard your doctor telling you about Olistat or about this medication called phentermine, topiramate, and about the GLP-1s and the dual GLP-1s and the GIP-1s. There are many medications out there, many, many. But today we want to focus on those medications that you have been hearing about, your friends or family members are using, and you really want to know more about these medications. Like, what exactly are these medications and are they truly helpful? So today we want to talk about them. And that's why we will focus on the GLP-1 and the GIP-1 medication, the combination of the GLP and the GIP. So if you've heard about the medication, so just to mention them, we have the liraglutide, the dulaglutide, the semaglutide, and the tirzepatide. I know this medication sounds like jargons, but let's call it the name we all know. So we have the Victoza, Saxenda, Trulicity, Ozempic, Wegovy, Rebelsos. We have the Zepbound and the Mounjaro. So these are the medications we just want to quickly highlight for you to see how you can use them and what are the purposes for using them. So over to you, Dr. Hope.
Thank you, Dr. Grace. So, weight loss medications is a hot topic these days because there are some very effective weight loss medications out there. So, but we just want to differentiate the effectiveness of each of those different medications and also talk about the indications for some of those weight loss medications. So, let's start out with the newer, I'm going to be talking about the GLP-1 medications. So that category of medication, which is the latest category of medication that has been shown to really be effective in weight loss. So one of them, the first set of medications I want to talk about is the liraglutide, which has been out the longest. And that is, it's a daily injection. Victoza is the one that we know most commonly, but Victoza is indicated for diabetes specifically. But patients with diabetes who take Victoza can get a weight loss of up to, on average, 6.2 pounds. So Victoza is a daily injection, as I said, with a weight loss of 6.2 pounds. In that same category of liraglutide is another medication called Saxenda. Saxenda is indicated for weight loss. And it's also a daily injection, and the weight loss average is about 12 pounds. So those have been out for quite a few years and have been somewhat effective in weight loss. But again, the Victoza is indicated for diabetes. So let's go on to the next group. The next group is dulaglutide or dulaglutide. It's Trulicity is the brand name for it. And that is a weekly injection that is indicated for diabetes. Patients with diabetes can get a weight loss of 10 pounds on average. So Trulicity is a good medication for diabetes and weight loss combined. The other class is the semaglutide class. So in this class are three medications. Ozempic, which is indicated for diabetes, and patients with diabetes can get a weight loss on average of about 14 pounds. Ozempic is a weekly injection, so it's once a week, a subcutaneous injection, and it's effective for controlling diabetes and also weight loss. Wegovy, in that semaglutide class, is another medication that is specifically now indicated for weight loss. The weight loss average is about 35 pounds in the studies. So, and these averages are usually with the highest dose of the medications, of those specific medications. So Wegovy as well is a subcutaneous injection given once a week. The other medication in the semaglutide class is Rybelsus. It's an oral agent and it's indicated specifically for diabetes. But patients who take this medication who have diabetes can have an average weight loss of about 4.4 pounds in the first month. Okay, so let's go on to the next class of medications or the next group of medications within this class. This group is terzepatide. There's a slight difference with this group of medication. It's a combination of not only a GLP-1 agonist, but also uh, a GIP medication as well. So the mechanism involves two of the gut hormones, GLP-1 and GIP. Within this class is Mounjaro. Mounjaro is indicated for diabetes, and patients with diabetes can lose on average 25 pounds as well. There is a medication in this class specifically indicated for weight loss, and that is Zepbound. Zepbound is associated with a 48-pound weight loss on average, whereas Mounjaro is associated with a 25-pound weight loss on average. So these are some of the medications, some of the newer medications that are now indicated for diabetes and some for weight loss as well. There are many, there are some side effects, I shouldn't say many, but there's some side effects of these medications and some warnings. So in general, these medications are all contraindicated, meaning they should not be taken if the patient or the person taking them has had a history of medullary thyroid cancer or has a family history of medullary thyroid cancer. Another contraindication is a family history or personal history of multiple endocrine neoplasia type 2. And then finally, any previous allergic reaction to any of the ingredients in those medications is a reason not to take those medications. And they all have very common side effects, the most common of which is nausea. The nausea can be seen initially in some of these medications, and a lot of times it actually can improve, but sometimes it can be persistent. In addition to the nausea, there's decreased appetite, which is the purpose of some of these medications, right? But decreased appetite is an effect of these medications, sometimes vomiting, constipation as well. Hypoglycemia or low blood sugar can be seen in some of these GLP-1 or GLP-1 GIP combinations, especially when taken with other diabetes medications. So if a patient has diabetes and is taking one of these medications, but is also taking other diabetes medications, there can be some low blood sugar as a side effect. And there are some serious side effects that can be seen. They're more rare, but possible. One of those serious side effects is pancreatitis, which is inflammation of the pancreas, and that usually manifests as abdominal pain. And if that is the case, if someone is taking that and has severe abdominal pain, pancreatitis should be ruled out. But constipation is also a side effect, and stomach problems from those causes can also be a cause of abdominal pain. So you should have an evaluation by your doctor if you develop any of these side effects while on the medication. Kidney problems is another possible effect of taking these medication, a serious side effect that is less common. So anyone taking these medications should make sure you remain very hydrated. So drink a lot of water to decrease your risk of dehydration, which will also increase your or improve the benefit of taking these medications and decrease your risk of getting kidney problems. So drinking a lot of water, drinking a lot of fluids, staying hydrated is very important while taking these medications. Grace, back to you.
That was very, very wholesome and thorough. Can you imagine how within few minutes you already know everything about weight loss medications and things that you can do out there, even to the latest FDA approved medication. So, what are we to take home today from all these things that we have learned?
So the take home message is number one, diet and exercise is key. So we always need to control our diet. That's the number one lifestyle
Mhm.
modification that we always need to keep in mind. So exercise. So getting at least 30 minutes of some type of aerobic exercises most days a week. So greater than 4 to 5 days a week, including that in your regimen, along with adding these medications to your regimen can help with significant weight loss.
Don't take the medication and say, oh, the medication is taking care of it all. You still have to add your lifestyle plus the medication. Although one of the
That's right.
things with the medication is that it decreases your appetite for food. And remember
Yeah,
that weight gain, it's actually not good when you gain excess body fat. When you have too much of calories, it can cause a lot of problem, heart problem, you know.
that's right.
Yeah,
Yeah, so obesity and being overweight, as you were saying, Grace, increases your risk of many disorders, including some cancers. Some cancers are associated with obesity. Um, so, cancer, definitely heart disease and stroke. And actually, another benefit of these medications that I didn't mention is that several of them are associated with decreased risk of stroke, heart disease, and death. And
yes,
those medications include the Ozempic, Mounjaro,
yeah.
are
The
and even
Trulicity as well.
Trulicity
Yeah,
as well are
yeah,
associated with decreased risk of heart disease, decreased risk of stroke, and decreased risk of death. So they definitely have some significant benefits in addition to controlling the diabetes and the weight loss.
yeah. That's very fantastic.
Sorry,
Mm-hmm.
obesity again. This reasons why you shouldn't gain weight.
Mm-hmm.
Also associated with increased risk of developing diabetes. So remember,
Yes.
if you don't have diabetes and you're interested in weight loss, it's a very good thing because you don't want to increase your risk of developing diabetes. So losing weight, especially if you
Yeah.
have a family history of diabetes, and and a increased risk, personal risk of developing diabetes, losing that weight is very important in
Yeah.
preventing your progression to diabetes. And the weight loss is important with decreasing your risk of those heart disease and stroke as well.
Yeah.
um, so weight loss is a very important thing. Getting the right weight, getting well controlled eating, eating well, getting your exercise in. It has many significant benefits, health benefits, and there's overall well-being benefits. You
Mm-hmm.
feel better. You're less tired.
Mm-hmm.
You have more energy. It just
You don't
being
have those
the
knee pains anymore.
yes, that's right, right. So please let's work on keeping those New Year's resolutions and eating
Yes.
better, getting our exercise in, and if we need to, taking the weight loss medications.
Yeah. And
All right.
just to end up on this point, that you might be wondering if you qualify for the weight loss medications. According to the studies that were done and the indication from all these medications, if you have your body mass index above 30, which if you don't know how to calculate your body mass index, we encourage you to watch our video on obesity. You will see how we have explained in detail how to calculate your body mass index. So if your body mass index is greater than 30, some of these medications are already indicated for you. Or if you have body mass index greater than 27 and you have other medical health conditions related to obesity, you're also already automatically qualified to take these medications. So go
That's
out
right.
there, go see your doctor, do what you need to take, follow it through, and share your comments in the comment sections about your weight loss, what you have taken, and how you have been able to lose this weight. Uh, Share this information around with your families and friends, and together let's make the world a better place.
Because the more you know, the better you
Better
are.
you are. All right.
Thank
So
you for
bye for
joining
now.
us.